Everybody, good morning. So today we are going to talk about bowel cancer awareness. Okay, so with amazing Dr. Liesel, and while we're waiting for her, I'm going to introduce myself. My name is Ange, or Anjali if you like to call me, and I have been women's health movement coach for past 16 years and nutrition counselor, as well as founder of this platform. Now I am waiting for Dr. Liesel. I'm going to send her, maybe she will, yeah, okay, I got the request here. Read Dr. Liesel. Oh, here she is.
I'm
Hello.
here.
You made it.
I
Yay.
made it. This is my first live, so
Whoop,
it's
whoop.
all new for me.
Welcome and
Thank you.
congratulations.
Thanks.
Amazing. Carrie is here too. Carrie, nutritionist. Okay, welcome everybody. Thank you so much for being here. If you can hear us, give us a thumbs up and we're going to start, okay? So I'm going to read Dr. Liesel's bio. So Dr. Liesel Ryan is a general practitioner with a keen interest in perimenopause and menopause care. She also focuses on inflammatory bowel disease. She has personal and professional experience in both fields and works collaboratively with patients to optimize their health and whole person wellness. Welcome, Dr. Liesel. Thank you again for being here and your time.
Thank you, Ange. It's great to be here.
Yes, and so we're going to, before we start, I would like to read a little bit of disclaimer that this talk is all about to bring awareness and to our community. And if you not a, yeah, I have to add, not a specific advice.
Yes.
So if you need support, please go and reach out to your general practitioner or healthcare practitioner, and you can also maybe connect with Dr. Liesel, right? And
Sounds good.
would you like to add anything before we start?
No, I think you've said it all. We'll get
Yes.
stuck into the topic, which is a big one today.
Okay, let's get into the topic. Okay, so let's start with what is bowel cancer?
Right. So bowel cancer happens when there's an abnormal growth of cells in your colon, which is the large bowel. So we call it
Yes.
colorectal cancer or CRC. It's when things start going wrong. So when your body stops repairing things the right way and making normal cells, starts to make abnormal cells. And initially there's just a small amount, but that can get bigger and bigger and bigger, and it can form into a cancer, which can then spread it to the rest of your body. And that's what we're trying to avoid by talking about this topic early and making people aware of how they can reduce their risk of bowel cancer and
Yes.
also pick it up early if they do have it. Does that make
So
sense? Yeah. Abnormal cells can go wild, cause a
yes.
cancer.
So with the abnormal cells go wild, and then it starts forming into like little polyps and things like that, or
Correct.
unwanted.
So generally, a lot of those cancers start as little polyps, so abnormal cells which form polyps, which are just like little outgrowths from the bowel. And sometimes those polyps, they stick around and they don't cause any trouble. But in certain cases, some of the cells in those polyps in the abnormal growth can then go on to become very abnormal. And when those cells become very abnormal, they can form a cancer. Those cancer cells are then able to spread around the body. And this is the point. It takes quite a bit of time for that to happen. So we've got time
Yes,
on our side.
and the thing is that yeah, and we wanted to talk about the stats as well, right? To
Yeah,
bring
yeah.
awareness and prevent
Absolutely.
it from
Yeah.
happening. So
Yes,
would you like to talk a little bit about that?
I would. I think it would shock people to know that bowel cancer is the second deadliest cancer in Australia. It's unbelievable. I'm not sure people are aware of that. 103 people in Australia die every week from bowel cancer,
Wow.
and about 256 people are diagnosed every week, right? So those are, we're talking big numbers. So it's quite a serious problem. The
Yes.
good thing though is there's things we can do to pick it up early, because the earlier the better. If we pick up bowel cancer at the very early stage, there's a really good chance of complete cure. And so that's why we want to focus all of our attention on, is picking up stuff early, making people aware so that they're
Yes.
looking out for signs, they're participating in a program, a bowel screening program that is run in Australia, so that if it is a problem, we're picking it up super early.
Yes,
Um,
the bowel cancer, the checkup is I think provided by Queensland government, isn't it?
it's provided Australia-wide, actually,
Australia
which is
wide, and
fantastic.
it's free service,
It's
right?
free. So the screening program, screening is for people who are completely well, have no symptoms.
Mm,
They're just going to go, right, okay, your risk is getting increasing because you're getting older. Let's start testing you. In Australia, we used to screen everybody, and I explain what the screening means every 2 years from the age of 50. But
mm,
because we're noticing a younger age people getting bowel cancer, they've actually
yes.
just reduced it to 45. So we have this program, which is a centralized program in Australia where people might know this who are watching this who've actually opened the mail and gone, welcome, you're 50 or 45 now. Here
Yes.
is your bowel kit. And they put it in
Mm,
the bathroom drawer. But that's
hmm.
the program we're talking about. So it's a centralized program where you're flagged on a register. And when you
Yes.
reach the age of 45, if you've got no symptoms, you get a kit in the mail. And you'll do that kit. And I'll explain what the kit is about in a minute. And that's every 2 years from the age of 45 to
Okay.
74.
Mm,
Um, and then before that age or after that age, it depends on risk factors. So, but the program is funded and it's free in Australia, which is
hmm.
amazing, from the age of
Yes.
45 to 74, with the express um, goal of reducing deaths from bowel cancer, really. And
Yes.
it's not just the deaths, it's the other things that happen when people get bowel cancer, how it affects their
And
life.
I think it would be amazing kit for
Mhm.
prevention, right?
It
If
is
you
100%, because this is
yes.
what we're focusing on, and we really want to prevent bowel cancer. If
Hmm.
we get it, well, prevention is different. We want to pick it up early. We want to prevent
Yes.
the consequences of bowel cancer, right? So
Hmm.
screening can't prevent cancer, but it can pick up cancer so early that we can nip it in the bud and get rid of it, and it never goes nowhere,
Mm.
right? That's the
Yes.
big thing about screening.
Yeah,
Have
we
you
were
have you ever received a test in the mail?
me? No,
Yeah,
not yet.
you
Not
should.
yet.
So the actual test, do you want to know what the test is actually checking for? Would you like to know?
Oh, yes,
Yeah.
please.
So the
Yes.
test when you get it is actually looking at your stool, right? So your
Mm.
well stuff that comes out in the bathroom that people flush away and don't look at often. I'm
Mm.
encouraging them to look, by the way. But anyway, what we see where the early stages of bowel cancer, often there'll be small amounts of blood
Mm.
in the stool that you can't see. It's invisible. It's called occult blood, which just means invisible blood. You don't notice it. You have no symptoms. You don't notice that there's a tiny bit of blood. What
Mm-hmm.
this test does over a course, I think, is of 3 days, is
Mm-hmm.
it tests every day to see if there's blood in the stool. If
Mm.
there is blood in that stool sample, you're going to need to go and see somebody to have something called a colonoscopy, which is to have a look up into the bowel and see where is
Yes.
this blood coming from. Is it coming from a little polyp, which is possible? Is it coming from a
Mm.
hemorrhoid? If it's just a hemorrhoid, great, we know it's a hemorrhoid, but we
Mm.
never know where that blood is coming from. So if it's a
Mm.
positive screening test, it always results in a colonoscopy, or it should, right?
Yes.
And that's another thing that's centralized. So we find that as doctors, if we get a result from a patient that was positive, we'll get a
Mm-hmm.
letter going, has your patient had their colonoscopy?
Yeah.
To make sure that we've picked that up.
Mm.
So that's what it's doing. It's looking for invisible blood in the stool that you might not even notice.
Mm-mm.
It's really
So
important.
that test will help us to detect that.
Yes. It's
Mm.
not the flip side is a negative test doesn't mean there isn't a cancer there. So it's not
Mm.
100%. No test ever is 100%. So if you've
Yes.
got a negative test, but you've still got lots of symptoms, you're still
Mm.
going to be pushing for, we need to figure it out.
Mm. If
Because
something doesn't feel
it
right,
doesn't
yeah,
feel right, you
advocate for
still got to look
yourself.
at it. But
Oh.
really, it's for this screening test is for people who've got no symptoms, they're otherwise well, they've just reached
Hmm.
the age where their risk is going to go up. And so let's just check them every 2 years and make sure that there's nothing going
Yes.
on. And if
No,
we
I
find
was
something, we act.
yeah, I was going to say while you're looking at your number two, but if you had a beetroot juice or beetroot, then
Yes,
it might be different.
that does happen. People freak out. Oh my gosh, what happened? It's okay.
Yes,
That won't come up positive in a test.
yeah, but
Beetroot won't make the blood
sometimes,
freeze.
yeah, sometimes you look at it and you freak out because you don't realize that you have eaten a beetroot
Yes.
past few days, and then all of a sudden you see red, and
You
it
do.
happened to me a few times. That's why I'm just wanting to let people know.
Yeah.
And so while we are talking, if anyone of our guests, if any one of you have a question, please pop it in the comment section, and then Dr. Lisa would be happy to reply to that.
Mhm.
So, okay, so we just talked about the kit, and let's talk about the early detection why the early detection of bowel cancer is so important and what signs should people never ignore.
Okay, so there's a couple of things there. There's actually a few little different topics within that
Mm-hmm.
those statements. One
Yes.
is the screening. Obviously, we've talked about really important because it picks up people who've got no symptoms whatsoever.
Mm-hmm.
And if their test is positive for a blood in the stool that they can't see, we then
Mm-hmm.
can investigate that, and that'll hopefully prevent any nasty things happening down the track. And if there is a
Yes.
cancer, get it super early. The things that the problem with bowel cancer is that the early signs are often not there. So this is a
Mm.
cancer which if can present late. By the time you've got symptoms, and we'll talk
Yes.
about what the symptoms are, that cancer is probably still is quite advanced. It's quite at a late
Mm.
stage. So this is why screening is so important. But the things, so early signs can be even fatigue, iron deficiency in women, and we'll
Mm-hmm.
have a talk about that. Iron deficiency
Yes.
in women should never just be put down to heavy
Mm.
periods, and bowel testing should also be done. But early signs of maybe a bit tired, bit of iron deficiency, could be an early sign. The signs you mustn't ignore definitely are things like blood in the stool. If you look in the
Mm.
toilet bowl and there's actually blood in the stool, it doesn't
Yes.
matter whether it looks like it's bright blood or whether it looks darker or whether it's mixed in with the stool or it's in the toilet, you need to go and see somebody. That's a
Yes.
really important thing. I've heard too many stories of people going, I think I'll just wait for a couple of months. Maybe it'll go away.
Evolve,
I
go,
think
go.
people
It
are
does.
afraid or they just go, look, I'm just going to ignore it. That's too hard to deal with.
Mm.
Please, people, if you see blood in the stool, in the toilet bowl, on the paper, wherever, please go and get checked. Just to make
Mm.
sure, okay?
Yes.
People are
So,
embarrassed to talk about this topic. And my
oh
big thing is we
yes.
need to just remove that shame and stigma and go, everyone has bowel movements and we all need to talk about them because talking about it saves lives.
Yeah, it
So,
it
yeah.
might save lives.
Yeah. So
Yeah.
that's the big one. And other things to not to ignore it, and maybe changes in your bowel habit. And suddenly, you go, oh,
Mm.
everything's different. I've got, maybe the consistency of the stool has changed or the shape. Sometimes people will come and go, everything's sort of skinnier than it used to be. That could be because there's a narrowing in the bowel, or
Yes.
it's much harder for me to go to the bathroom suddenly. It just seems like I'm constipated, or I've got abdominal
Mm.
pain, or I feel full really quickly, or I'm a bit sweaty at night and I've lost weight. Any of those
Mm.
things, big red flags from a doctor's point of view, and should be big red flags for people going, you know what, don't ignore that. Get in
Mm.
early. It could be something entirely different, but what we want to
Yes.
focus on this month is bowel cancer because we need to, that's the big one to exclude, right? So
Yes.
don't ignore those signs. But again, because it can be so insidious in the beginning, because you
Yes.
might not notice it,
It's very
it can,
sneaky, right?
it's very sneaky, which
Mm.
means that younger people who've got sneaky symptoms, it can be harder to pick up. So my
Mm.
biggest push here is go and speak up to somebody. And if you find you're not being listened to, find somebody who will listen to you.
Mm.
Bowel stuff
Because
is really important.
yeah, with my daughter, it was very hard to identify whether it was a hunger pain or it was a period pain or it
Yeah.
was a real what it is, and so we had to do the thorough check, the stool, the 3 day stool, like you said, the
Yeah.
stool
Yeah.
sample. We did that
Mm.
one, but we didn't see anything. But so just to avoid that, we did
Yes.
that test for
Mm-hmm.
her. And for
Mm-hmm.
myself as well, we did
Mm-hmm.
because I started getting really low in iron,
Mm.
so I had to do the colonoscopy, but
Yeah.
I have been plant-based for
Mm.
6, 7 years.
Yeah.
And then my doctor said, okay, we'll keep an eye on, let's start introducing slowly,
Mm.
broth or meat
Mm.
slowly. And if that would make change, because we couldn't find anything when we did the colonoscopy.
Yeah.
So
But
it
that
just finding that, right?
find their balance. And that brings up such an important point. Women, particularly younger women who've got heavy periods, or
Mm,
even women in perimenopause and who've got heavy periods, I never want that iron deficiency or maybe sometimes even anemia, which was when their red cell count drops because of that, to be passed off as just because of heavy periods.
mm,
That needs to always be investigated from a bowel point of view as well. And unfortunately, too many women, I think, think I'm tired and I've got heavy periods and that's why I've got all these problems. Please be
mm,
aware that bowel cancer can happen early.
Yes.
As a doctor, I've picked up bowel cancer in young women and even women in their early 40s who were before the screening test, right? So they didn't have any symptoms other than they're a bit iron deficient, a bit anemic, a bit tired, putting it down to, oh, I've got a busy life, I've got young kids, I've got
Yes.
heavy periods, I'm working, I'm looking after parents. Women tend to put themselves last in that age group. And my really big push for women out there is this should be investigated from a bowel point of view as well as a female health period point of view.
Yes. Not dismiss it as
Yeah,
the heavy. Oh, I had a heavy period, so
that's
that's why
why.
I'm feeling
Yeah,
tired.
yeah,
Yeah. So if something doesn't feel right, just advocate for yourself,
100%.
right? And talk
Yeah.
to your healthcare
Mm.
practitioners.
Mm.
Yeah. So what are the different symptoms between men and women, like we were talking about?
Gosh, well, I think this is where it gets tricky for women because for men, I mean, people experience all the same things together as men and
Mm,
women with bowel changes, etc. But it's the abdominal pain part of things. I think that women can get a little unstuck there because it's a bit
mm,
hard to work out, is this a menstrual cycle disorder or is this a bowel disorder? And the two can often coexist. Okay, so there are
yes.
other things that can come into it. So I think it's a bit more complicated with women to tease out the actual symptoms. Just
Mm,
requires somebody to sit with you and really think about, okay, let's talk about all the different things that are happening for you, because men don't have any of the menstrual side of things, obviously. So it
yes.
actually makes it a
We are
bit
not
simpler.
dismissing men,
No,
right? No, their
but
health is very
yes,
important. We
but
love them, but yes,
but
because we are
what's
such a different people, like
yes.
yeah, physiology. Yes.
And I love that saying of men are not, women are not little men. Women are not
Yes.
little men. We're very different in that respect. It doesn't
Mm-hmm.
make us less than or better than. It makes us just different. You know, we're
Mm-hmm.
different with different needs, and we need to address those issues and make sure that we listen to people.
Mm-hmm.
Women need to put their health first as well. They tend to put themselves last in the family quite often.
Yes.
But you know what? You need to be as healthy as possible. So if you've got issues like that, you're feeling that there's something going on, please go see somebody. Mm.
Yes. And once, if we take care of our health, and this is a statement for myself as well, if we
Mm.
take care of ourselves, then we will be able to look after our family, right?
Absolutely. If something
And
happens to you,
yes.
mm, mm,
And then, yeah, so please let's do this together and not not
not
ignore it,
yeah.
right? Yeah, any symptoms, just be proactive about it.
Can I talk a bit about risk factors as well? Shall
Oh,
we talk
yes,
a
of
bit about
course.
risk
Yes.
factors? Are we up to
Yes.
that stage? Yeah. So, there's good news and there's bad news with this, right? So some risk
Mm,
factors, we call them non-modifiable, meaning there is not much you can do about them. It is
mm,
what it is. For example, being over 50 increases your risk. You might have a family problem or a genetic issue. There's something called Lynch syndrome, and there's another one called familial adenomatous polyposis, which increases your risk of bowel cancer. If you have those things, you can't do much about them. You just need to start checking yourself a lot earlier, right?
mm.
Other things like my other passion, which is inflammatory bowel disease, which is
Yes.
Crohn's and colitis. People with those diseases, particularly if they're not well controlled, so particularly if they have had bad symptoms and it's not under control, they are more likely to go on and develop bowel cancer than
Mm,
somebody without inflammatory bowel disease. And I've seen that happen, and it's very sad. So
yeah.
we have to be aware. Now, those are things you can't actually do much about. But the good
Hmm.
news is there's a whole bunch of what we call modifiable risk factors, meaning you can
Yes.
do something about them. So we can increase our fiber in our diet, so increase fruits
Hmm.
and vegetables,
Yes.
reduce your intake of processed foods,
Hmm.
particularly processed meats. You can reduce or minimize alcohol or reduce it entirely.
Hmm.
Don't smoke.
Yes.
Smoking increases the risk of all cancers, right? As does alcohol, actually. So the
Yeah.
less alcohol, the better. And increase physical activity. So moving your
Hmm.
body, being active, actually helps us as to decrease your risk factor for bowel cancer.
Yeah.
As well as maintaining a healthy weight. So we have to be careful with weight because people don't like to be fat shamed or obesity shamed or any of these things, and
Mm.
that's not what we're doing. What we're saying is that be in a healthy range of weight for you, be active,
Hmm.
don't smoke, don't drink or drink a little, eat a healthy sort of Mediterranean style diet, which is full of fruits and vegetables, get some exercise and avoid processed food. It's actually not
Hmm.
so hard. And doing those things can actually help reduce your risk of bowel cancer. So it's amazing. You've got that power to change your risk,
Yes. Yeah.
which is what we want
So,
to get out there.
yes. So I couldn't get the catch the all the phrases that you the all the disease
Too
you
much
mentioned
jargon.
earlier. Yes. So,
Sorry.
but no, that's okay. But what I took from there is if you have any symptoms of the, not symptoms, but any disease prior to the bowel cancer,
Mhm.
you might have more prone to it. Is that correct?
Yes,
Okay.
absolutely. So if you've got things like Crohn's disease, which I have actually,
Hmm.
and or ulcerative colitis, which are diseases which affect it cause a lot of inflammation in the
Hmm.
bowel. Inflammation that is not controlled, so uncontrolled inflammation
Hmm.
is a risk factor for developing abnormal cells, which is then a
Yes.
risk factor for bowel cancer. So having those illnesses, especially if they're not well controlled, is a risk factor, will increase your risk of bowel cancer. It's a well-known
Hmm.
fact. So people with those illnesses, and there's about 180,000 Australians who live with
Wow.
inflammatory bowel disease,
Mm.
have to be also very much aware that then their gastroenterology teams, etc., would be on that
Hmm.
as well, going, right, okay, your risk is increased, so we need to watch you.
Yeah.
Um,
Keep a close eye
Keep
about
an
it.
eye on you and make sure that your medication is working or your lifestyle is working
Mm.
for you to control your illness. So,
Yes.
um,
Yeah, I wanted to quickly touch on maintaining weight because myself, I am like not recovering, but eating disorder person
okay.
myself. So with that, it always I have the tools now these days, so
Mm,
you know how to maintain it. It's
mm,
so that helps. But if anyone out there needs support,
mm,
and yeah, you have the support, you know, nutrition,
mhm,
dietitian, look out for help, or
mm,
you know, your general practitioner will be able to guide you
mhm.
towards that if you have.
Absolutely. It's a
Mm,
careful conversation, and I'm really mindful of that with
yes.
people who've got a history of disordered eating, is that
Mm,
discussing weight is really difficult. And rather than
yes.
discuss weight, I discuss health. So we're not looking at so much on the number on a scale, we're talking about
No.
health. We're
Yes.
talking about let's get you healthy. We want you to
Mm,
be able to move your body, eat the foods which support your health,
yes.
rather than focusing on other things, because it's a very tricky situation and has to
Mm,
be very carefully addressed. So
yes.
I hear you
Exactly.
on that
So.
note. Yeah.
Thank you for being mindful of our community, and because I truly appreciate that, because
Mm.
with our mindset, it's the triggering things are so strange,
Yes.
different,
Yeah.
but when you're talking about more coming from health and well-being
Yes.
and you know that focus, and it
Yeah.
completely shifts the
Yes.
idea. So
Hmm.
I truly appreciate that.
No
And
problem.
so before we go to our final question, I just wanted to ask anyone if you have any questions, please pop it in the comment section for Dr. Liesel. And while we wait for the question to come, um, please give us some final words, preventative or anything. What
Hmm.
would you like to talk about in this bowel cancer awareness chat?
My really top message is
Mm-hmm,
bowel cancer should be kept should be detected early. Don't ignore your
mm-hmm,
body. Participate in the screening program. Please do that, because prevention is key here. Picking it
mm-hmm.
up, it prevents picking it picking doing bowel screening doesn't prevent the cancer, but it prevents the progression of the cancer, right? So if that
Yes.
makes sense. So that is really, really key. There are a lot of people who will be nodding their heads now going, yeah, got their kit in the mail and they put it in the bathroom drawer and it's still sitting in the bathroom drawer. And
Yeah.
my challenge to all of you is to get them out of the bathroom drawer and to participate in the program, because you're
Yeah.
doing something for your health. So if you want to live a
Yes.
long, healthy life, active
Hmm.
and participating in the things that you want to do, participate in your screening program, participate in bowel screening program. It
Yes.
could save your life.
Yeah. And it is free. And
It's
it is
free.
a free
That's right.
service.
It's
Yes.
free.
I wanted to the address in that because I come from Nepal. We
Mhm.
have nothing like this, what
Mm,
we get in Australia. And I
mm,
always feel so grateful about the healthcare system here, that how much you know, we get
mm.
for, you know, but it just not being aware,
Yeah,
and then the not being aware of all the resources and
yeah,
the, you know, like we're talking about it, so we
yeah,
can let people know that
exactly.
this is a life-saving program that you should participate, and we all should do that.
Absolutely.
Yes.
And the
And
other thing is we should be removing the any shame or embarrassment about talking about bathroom habits and talking
Yes.
about bowel health, because people don't mention these things because they are embarrassed. And really, what I want to say to you is don't be embarrassed. Everybody is the same. We're all human
Yes.
beings and we need to talk about it. If there's a problem, we need to talk about it. So please
So,
also
mm,
keep that in mind as well.
yes, if we can save lives, we
Yeah, we should
should
be
start
doing.
making the
mm,
conversation about this, right?
Yeah.
And yes, okay. So if anyone has any question afterwards, you'd like to, after we finish this conversation, and if you're watching this live and you have questions, Dr. Liesel, where can people find you and send you a message, or how can they reach out to you?
The best way at the moment would be to contact me, message me on my Instagram page. So I think
Mhm.
you've got a link there as well.
Yes.
So at drliesel.ibd.iliastomy.hub, I
Hmm.
will answer all the questions that you might have, and we can discuss anything that you might have a concern about. Obviously, it's not medical advice. I'm not here to give medical advice, but I'm
Yes.
here to maybe interpret or answer some questions and maybe guide people in the right direction.
Hmm. That's amazing. Thank you, Dr. Liesel, and thank you everyone for being here and participating in this beautiful chat that we had with Dr. Liesel on the Bowel Cancer Awareness Week. So yeah, let's spread the message and slow down the progression of second disease, deadly disease. It's not so let's participate in this to bring awareness and reduce the risk.
And
All right. Have an
lovely to
amazing
chat to
day,
you.
everyone. Thank you, Dr. Liesel. Thank you for your time.
Bye.
Bye
Bye,
bye.
Ange.